I think we'll get started. Thanks so much, everyone, for being here. I know you have a lot of other places you could be, and I appreciate your um, coming here tonight. And I know people have a lot of questions about what's happening out there in the world. And so I want to leave a lot of time for questions, but I'll start with Judy Amabile. I am the state senator for District 18. That is the city of Boulder, Louisville, Superior, Niwot, and Gun Barrel, and the unincorporated parts of Boulder County in between those towns. I have been in the Senate I've had one session in the Senate. I was your state representative for many people. Prior to that, in House District 49. So this will be my 6th year in the General Assembly. And this year is shaping up to be like really none other. Um, I mean, we've had lots of interesting and hard to deal with things that have happened during my time in the legislature. We had COVID but the politics in Washington, D.C. and the presidency of Donald Trump and the sort of fast-paced change in policy has been a really difficult thing to keep up with and to address. And I know we're all seeing some really terrible things, including the murder of a citizen by ICE agents in Minneapolis. These are all things that I care deeply about and that we need to address at the state level in whatever way we can. And we are working on the levers that we have to address what's happening. I am on the Joint Budget Committee, and we have been meeting every day. Well, not every day, but pretty much every day since early November. And we have a very difficult budget in front of us. So the first thing that happened was HR 1, which dramatically reduced our revenue. So had a balanced budget on June 30th, and on July 1st, when that bill got signed, our budget became the budget for the current year that we were in became completely out of balance because of the way that we connect with the federal income tax. So all those income tax breaks flow through to Coloradans' taxes, mostly higher income earners and corporations. And so we did some things in the special session to mitigate that, but we weren't able to completely fix that problem. And then in addition to the revenue decline, we also have a whole bunch of, we have a structural deficit with our budget where Tabor puts a cap on how much money we can raise and how much money we can spend. And that sort of artificially constrains us. And we also aren't allowed to raise taxes to cover those things. And then we've had all of these federal decisions that have raised our expenses. We are in a unique situation this year. Normally, we bring in more revenue than we can spend because of Tabor. This coming budget year, we're going to be below the Tabor cap. So we will bring in less revenue than Tabor would allow. And that creates a whole other set of problems because we have tax credits that get paid out of the surplus. And so instead of paying those out of the Tabor surplus, we will have to pay for those out of our general fund. And the bottom line is we have about $1 billion budget deficit that we have to try to, we have to address, actually. Colorado is constitutionally mandated to have a balanced budget every year. And so that's what we have to do. And just to give you a little bit of context, Medicaid accounts for about 32, almost 33% of our general fund budget. And Medicaid costs are rising much more quickly than inflation, much more quickly than the Tabor cap allows. And if we don't rein in our Medicare expenses, it will, in the next 5 or 6 years, crowd out everything else. The second biggest bucket at 27 or 28% is K through 12 education. Then higher education at 10%, human services at 8%, corrections at 6.5%, judicial at 5.2%, and 10% everything else. So a lot of what the way this budget process works is there are forecasts, the governor produces his budget proposal, and then the Joint Budget Committee meets. We have briefings from our staff for every department. We talk about their budget requests. We meet with the governor's team to talk about his request. Then we have hearings where all the departments come in and talk to us about what they're facing and what's important. And then we go to figure setting, and we haven't started that yet. We're still in the hearings. We also have supplementals where we try to plug holes in the current budget. And there are lots of those. For example, Department of Corrections needs a lot more money in the current year than what we were anticipating. So we have supplementals, and then figure setting. Then the departments can come back if they don't like the decisions we've made, which they will not like the decisions that we make. And then we produce a balanced budget. And this year it's going to be really hard. So that's a quick summary of what's happening at the Capitol. I am also working on my legislative agenda for the year, and I'd be happy to talk about that if that's something that people are interested in. And I think we'll just start with questions. And Robin, tell me if I've got this right. Oh yeah, raise your hand. So if you just go to the react button and put up the raise hand, and I see Kitty Sargent has a question. Kitty, you're
okay. There. Can you hear me?
Yep.
Great. So you won't be surprised to know that I am interested in the impact on K-12 education. Is this echoing for you?
A little bit. I think it's, yeah.
Is that better?
Yeah.
Good. Okay. So yes, the implications for K-12 education.
Yeah. Well, so right now there aren't cuts to the funding formula or to the there aren't cuts from the state to K through 12. We don't know the full picture yet, but the governor's budget did not request. The Department of Education, there were some cuts to some of the programs that they run, but there weren't any cuts proposed to the state share of funding for K through 12.
So even with the $1 billion deficit, you don't think there'll be cuts?
Okay, so let me rephrase that. The governor's budget proposal did not have any cuts to K through 12. I don't really know where we'll end up. I don't think that there's a lot of appetite on the Joint Budget Committee to cut K through 12 spending.
That is great to hear.
Yeah, I haven't heard anybody say that that's a place where they think they could find money.
Because as I'm sure most people know, money spent on children is the best money we can spend, and will give us, it's like a 2-to-1 return. So if we want to make sure we have educated people to run the country someday, and to run the state and our cities and everything else, we need to have robust funding for education.
I completely agree.
And I also, Judy, want to commend you for your advocacy for improving treatment for sex offenders.
Thank you, Kitty. That's like the third rail of politics.
Yeah, I know. But I went and saw the sex offender program years and years ago and sat in a treatment circle with some offenders, and it's tough stuff, and anything we can do that'll make that better will also keep our children safer.
Yes, I agree. Okay, Lisa. Thank you, Kitty.
Hi, sorry, let me get off my on my video. Hi,
Hi,
Judy. It's nice to see you.
good to see
Um,
you.
I have a couple questions. Well, first of all, I was hoping you could just talk about your legislative agenda. Um, and in my UP hat, I was wondering if you're running any insurance bills this year. And in my constituent hat, I'm wondering if you can speak to the Front Range Light Rail project and if you have any say in what's going on with that. I have talked to some people running for the RTD board as well as just hearing about it. And I hear that there's potential that they're going to try to put something on the ballot to raise taxes for that. Which I have to say, as a 25-year resident of Louisville and a many-year resident of East Boulder County, I have a hard time with that, considering we've been paying for 20 years and we still haven't gotten any light rail. So I guess I'm just wondering what your thoughts are on that and what's going on. I support having the Front Range Rail, but I just feel like people need to get their act together if they're going to ask the voters to actually pay for that, right? After paying for 20 years and all we've gotten is the Flatiron Flyer and the airport bus. So.
Yep. Okay. Thank you for those. So Front Range Rail, if anything happens with it, it will be a ballot measure. We're not going to allocate resources to that out of the general fund. So that does have to come through a ballot measure. I agree with you that I think they will have a hard time getting Boulder to vote for that without doing a better job of communicating with us about exactly what we will get and when we will get it and what it will look like. So I think they understand that, and I think they know that without Boulder, they won't get that ballot measure passed. So I think there is a desire to make sure they get that right if they're going to put it on the ballot, and it might not be this year, it might be the following. In terms of homeowners insurance, we did run a bill last session that would have put a fee on everybody's policy in order to bring down rates for everybody. And I was one of the prime sponsors of that, and it didn't make it through. People really didn't like, some of my colleagues didn't like this fee idea because they felt like that was just raising the price of insurance. And I see somebody clapping for that, and I totally understand. So we will be back with a different proposal, and I don't know exactly what it's going to look like. It hasn't been completely fleshed out, but I do think you should expect to see a bill that is aimed at bringing down the cost of homeowners insurance. We talk a lot about affordable housing at the Capitol and everywhere, at the city, at the state, everywhere. And if we don't get homeowners insurance, the rapidly escalating cost of homeowners insurance, if we don't address that, we won't have affordable housing. That is a housing cost. And I know that many of you have experienced just massive increases in your homeowners insurance. I know I have. And that's unsustainable. So we do have to address it. And we have to be careful. It's a very nuanced conversation because we don't want to inadvertently make it worse. We don't want to see a lot of companies leaving the state, which happened in California. So it is a tight rope to walk, and we are going to be working on that this session. And then in terms of my legislative agenda, I think I know a lot of people are concerned about these license plate reader cameras. And so we will be running a bill to put some guardrails around this. It's called, the company name is Flock. I think if you've heard about it, you've heard it as Flock. It's been, wildly adopted by police departments and sheriff's offices around the state. And while I think there is a very legitimate law enforcement purpose for this technology, we do have to put some guardrails around it in order to make sure that people's privacy is protected. And then I'm also working on this competency, which I feel like a broken record. This will be my 7th or 8th competency bill, hoping this one will be the charm. Um, Not really. There's not a bill that will fix the entire problem, but there are some issues around that need to be addressed. And also working on a bill around people who are in substance use treatment and what happens to them as they transition out of a treatment setting. That is when people are the most vulnerable, the most likely to die from overdose. And so we want to make sure that there's a warm handoff there. And I have a number of other mental health bills that came out of an interim committee that I'll be working on. And, you know, there's tons of other things, and I don't know if people really want me to run through the whole laundry list. So I think I'm gonna just go to Martin next.
Okay, thanks. Um, Quick question about a new law that I think was supposed to go into effect in February regarding the regulation of the use of AI to try to prevent discriminatory things like affecting hiring decisions. And then I think it got postponed to like maybe June or July or something. And are we actually going to get that? Because it seems like preventing discrimination would be a really, really important thing to do. And AI seems like it could be a really dangerous tool in a lot of hands.
Yeah. So the answer is, I hope so. Um, I think that the bill that got passed in 2024 was unworkable for a lot of the companies, not just the technology companies that are developing these technologies, but also for everybody who uses them. And that turns out, because the definition was very broad, that the number of users is huge. So, for example, Boulder Valley School District would have to really change a lot of the policies and procedures that they're using right now in order to comply with that bill, as would every city and county and basically anybody who uses a software package like Indeed or anything like that. So the bill didn't quite hit the mark, but I think there's broad agreement that we need to regulate AI. There just isn't there isn't complete agreement about how. So there's a lot of different factions that are weighing in on what they would like to see, and there isn't agreement. So the original bill sponsor, Majority Leader Rodriguez, had a bill that was about this discrimination, but then some of the consumer groups wanted it to be about liability. And then some of the small tech companies wanted to have it, implemented in a particular way. And the large tech companies wanted something different. So basically, nothing got passed in 2025 to fix what was not quite right about the bill in 2024. And then in the special session, we tried again, and we had a massive shit show, for want of a better word, about a couple of different bills and a bunch of different groups that were not really meeting with each other. And some deals got made between 2 out of 4 of the groups, but then the other 2 didn't like that. And so at the end of the session, the special session, we agreed to postpone the bill from 2024 until June and to come back at it. There's been a task force that's been meeting since the special session ended. And the last thing I heard is that they seem to be making some progress. And I expect, though, that there will be at least 3 AI bills this session that are about AI writ large. And then there will be a lot of smaller bills that are addressing particular things about AI. Like, for example, I'm going to be working on a bill that's coming from the House with Rep. Ryden that bans AI delivering psychotherapy. Just saying, no, you cannot do that. That you need a human. And so I think there'll be quite a few other bills like that. And I'm hopeful that we'll get this larger AI bill passed. And I see Lauren is next. Okay, we can't hear
Thank
you.
you. Yeah, there I am. Sorry about that. Hi, Senator. Of course, some of the programming and areas that have had a lot of chaos, so their last number of months have been the food and nutrition programming, mostly because of the stuff going on at the federal level that have trickled down to the state. What's the latest on some of those, what's happening financially with some of the food and nutrition programs that they're kind of spread across various departments, and then they of course, there's the SNAP Ed situation that happens. So is there anything new or important coming out of the latest financial conversations that are worth considering?
Yeah. So what happened well, first of all, there was in HR1 the changes to Medicaid, which are going to be devastating and very expensive to address. So the work requirements and the re-upping every 6 months instead of every year. And then more recently, what happened is that the funding for all of our big safety net programs, TANF and childcare and other parts of the safety net we heard, okay, your funding is cut off. Now, since then, we sued and there is a stay on the stopping of the funds. But we are asked to provide all of this information about how we are delivering these programs. And so the agencies are frantically working to give the federal government what they're asking for about how we're running our programs. We have until the end of January, and then that stay is no longer. Now, they might re-up it, and they might say the funds are going to flow again, and they might say, no, these funds are cut off. And if that happens, we are working on contingency plans for that, because we obviously are not going to just let people not have access to food, not have access to childcare, not have access to the programs that they get through TANF, the basic income assistance, all of that. So we are working on contingency plans. Hopefully the courts will stand with us and not allow the federal government to cut off this funding. But hoping for that doesn't feel like quite enough. So that's why we are working on some contingency plans. But the state of Colorado does not have enough money to fund all of these things by ourselves. And the money that comes from the federal government doesn't belong to the federal government. It belongs to us. It is our money. And we send the money to Washington, D.C. in order to fund the things that they fund. And so it is absolutely infuriating that this is happening and we're being yo-yoed around like this. And it makes it very hard for us to get our budget work done and to figure out what we're doing, because there's so much uncertainty out there. And it isn't just uncertainty for the state, it's uncertainty for all the counties and all the cities. And it's also uncertainty for all of the providers of these services, because they do not know, come the end of January, are they still going to be employed doing these things? And it's also a massive amount of uncertainty for our business community, because they're getting hit with tariffs and getting yo-yoed around with those kinds of things. So I don't know how much longer, like it's been 1 year. It's just been one, not even. And I don't know what happens in the next 3 years. But this is why I can't commit to here's what we're going to cut and here's what we're not going to cut, because we just don't know. And there's no way for us to know at this particular moment in time. But I do promise you that when we produce our budget, it will be balanced. It's just, I don't know at what cost to the programs that we're currently running.
Yeah. Thank you so much for your work. Appreciate
Yeah,
it.
you're welcome. Okay, I don't know if I'm going to get this right, but Sarah Savati.
Very good.
Okay.
Judy, first of all, I want to thank you and Robin for the help that you gave us during the Excel cutoff. 5 days is a long time, and you helped so much, and thank you. I'm also concerned about this homeowners insurance thing. And one of the issues, and I don't know whether anyone can do anything about it, but for those of us who live in the mountainous areas of Boulder County, even like I'm a CU alum, I'm supposed to be able to get coverage through a certain company. But when they look at my address, they go, "Oh no, we won't cover you because there's too much of a fire risk." And so that happens a lot. It affects all of us up here. That our rates are much higher. And as we all know, the worst fire in Colorado's history was in the Marshall Fire, and it was not in the mountains. So I just wanted to just kind of mention that since you brought it up.
Yeah, well, thanks for that. I know that it is an enormous problem. And people are starting to get turned down. And we have people who are finding that they cannot get insurance anywhere. There is not an insurance company in Colorado that will insure them. And so 2 years ago, because we could see this coming, the speaker and I worked on a bill that set up an insurer of last resort. And that is the place where you go if you get turned down by, I think it's, you have to be turned down by 3 or 4 insurance companies before you can get a plan through this Fair Plan program. That is no panacea. It has limits on the coverage. It won't cover contents. It's just the structure, the main structure. It's very expensive. So, and it's not meant to be, it has to be actuarially sound. So on the, just by the way that it was set up, it is expensive, but it is something. And in California, what we saw is that, and in Florida too, is that a lot of people are just uninsured. And that is, if that's a choice, fine, but it's not the choice that very many people would make if they had other options. So, so that happened. And we worked with the insurance companies on that because they do have to issue these, they're on the hook. If the FAIR Plan isn't bringing enough in to cover its expenses, then the insurance companies all have to kick in. And there is some reinsurance that's part of that, but we have to get at the cost problem. And again, we did a study about costs. We have some ideas about what we need to do to address it, but we need to, it's funny, in Colorado, the main driver of property insurance is not fire, it's hail. And so we had some parts of this bill from last session that were about helping people to put hail-resistant roofs on their property. And we still think that that is a lever that will make a big difference eventually if there are less hail claims. But we didn't get there. So there's still a lot of work to do on that. Isaac,
Thank you.
you're welcome.
Hey, can you hear me?
Yep.
Okay, great. Yeah, I just want to also say thank you for giving me this opportunity to be here in this meeting. Obviously, I'm kind of new and young to all this, but this is really important, and I like to be involved and know what's happening with my state and what's going to happen with my people. So one of my questions is, so obviously this past year, in 2025, Trump decided to, I think it was defund the National Center of Atmospheric Research here in Boulder. Is there anything that we're doing to prevent that from happening, or is there anything that we can do?
Okay, so yes, we are suing to stop that from happening. So the Attorney General is working on that, and we've been successful with a lot of the lawsuits that we've initiated so far. It doesn't mean we'll be successful with this. Obviously, this is a huge deal for the city of Boulder, for the University of Colorado, for the people who work at NCAR, but also for the entire world, because NCAR's work is so important. And so I will say that I went to the protest. I encourage everyone. I went with Phoebe, who's here on the call, and with Robin and a bunch of other people. And it matters that we show up. I also think that the people who have actually maybe more sway in this moment are the Republicans. And so you all should be trying to lobby them as well. Like, yes, Joe Neguse, our representative, is absolutely working on this. Michael Bennett is absolutely working on this. John Hickenlooper is absolutely working on it. But we need to get at Lauren Boebert, at Jeff Hurd, at Gabe Evans, and who's the fourth one?
Jeff Crank.
Thank you, Jeff Crank, because their vote matters, and the idea that our own congressional members aren't supporting our state in every way that they can is really just it's just so wrong for so many reasons, and we can make an impact on them too. And I see somebody's posting that Jeff Hurd is working on it too. And he has, and he is also working on this. Trump vetoed this bill around fresh water for the Eastern Plains that's been being worked on for years. And it's Lauren Boebert's bill. And it was, I think, almost unanimous, which is kind of unheard of in Washington right now. And Trump still vetoed it. And either that's punishing Colorado for Tina Peters, or it's punishing Lauren Boebert for her interest in releasing the Epstein files. Like, who knows? Luckily, I don't live in Trump's head, but it's it's not based in any actual policy or anything else. It's just some revenge tour, and that makes it so hard for us to figure out how to combat that. Do we suck up? What do we do? And so I'm not particularly in the suck up mode. I think we really have to make sure that we're out on the street, that we're talking to the Republican members of Congress, and that we're putting pressure on them to vote for our state instead of against us. And I would encourage everyone to get involved in whatever way you can in helping. There are some flippable seats in Colorado, particularly CD8, which is Gabe Evans, who won by like 1,000 votes. We had a Democrat, she lost. Gabe Evans won. He's only been there for 2 years. We can take him out if we all help with whoever comes through the primary in that seat. And there are other seats too where people are raising tons of money, and we might be able to flip a couple of seats here in Colorado, and that would make a big difference in 2020, starting in 2027 when we seat a new Congress.
Yeah, and I mean, if any time is for our voices to be heard, it's going to be now more than ever. I think a lot of people in Colorado are sick and tired of this government right now, and our government, the people who are in power on the Republican side, and maybe some Democrats as well. It's really disappointing that it's gotten this far, and we as the people, we need to stand up and we need to talk and we need to use our voice and not just sit down and look at the TV and say, oh, well, that sucks. There's nothing I can do. We need to do something.
Yeah. But what are you going to do, Isaac?
I want to use my voice as much as I can. Obviously, I've got in contact with Mrs. Kate from Colorado Mad Moms. That's where I want to start off for the mental health things. And, as I get older, to involve myself in more of these projects and be inside of these meetings with you and many other politicians, hopefully in the future. I've experienced a bunch of things. I've seen a lot of things. My friends, my family, they've experienced terrible, terrible things and fear because of the current administration that we're in, and that hurts my soul. I mean, ever since I was a kid, I knew what was right and wrong. I mean, obviously, you don't have clear morals as a child, but as I got older, I did begin to realize, where can I help? How can I help? Who can I help? There's just so much happening and it's disgusting. And I want to be a part of my generation to hopefully revert some things, some very hurtful things from our government.
Yeah. Well, thank you. And I know you and I met, and I'm looking forward to working with you this session. And so that's great.
Absolutely.
You're a great example for young people. And we do have to engage young people to the protests I've been to have all been people that look like me and Phoebe and Robin, and we need more people that look like you to show up. So thank you
It
for.
matters.
Yep. Okay, Renee, you're up.
Hi, can you hear me okay?
Yep.
Awesome. Thank you so much for taking the time to talk to us tonight and answer all of our questions. I'm an ER nurse, and I'm very, very passionate about mental health and behavioral health. But one of the things that I noticed is that there are a lot of regulations that require people or protect people with mental health issues or behavioral health issues, and they require hospitals or outpatient providers to do a lot of things. But we're not actually seeing our behavioral health partners held to the same standards where they actually need to staff beds or accept patients who have maybe insulin dependent diabetes or an underlying medical issue. And we're seeing that clog up our hospitals and really not provide the best care that we need to provide for our patients. So keeping all of that in mind with all of the work that you're doing with behavioral health and mental health advocacy, what is it that you're hoping to do to help partner with our behavioral health advocates and professionals so that they start to share some of the load of the expectations that they're placing on our communities?
Gosh, that's such a small little question, Angela.
Yeah, no problem. No small feat here.
Yeah. So, yes, every bill we work on, we do bring in advocates and we do try to partner with we try to understand, okay, how does this impact the hospitals? How does this impact nursing homes? How does this impact, providers who are doing outpatient services? And it's been very frustrating. I agree that we can't get everybody to row in the same direction. And part of it is, since we're talking in a big way, that we structurally have a healthcare system that is really fractured. And part of that is we have a for-profit system instead of a single payer system or a universal healthcare system. That would make things a lot easier. And instead, everybody's worried about their own little piece of whatever they're doing in healthcare. And they don't want to be burdened with patients they can't handle. And they don't want their rates cut, and they don't want to have to do anything different than how they're doing it now. And everybody's got sort of a little model set up that works for them, and people are unwilling to change. It's been an incredible, just an incredible frustration. But we do chip away. That's what we do. And we have made some strides. We got these transitional living homes funded, and they've been an incredible success. We've made some changes in policy. We've done some things around patient rights, but it's always two steps forward, one step back. Like one of the things, and I have no idea if this is answering your question or not, but one of the things we did was we said, if you go to a mental health hospital, you shouldn't be treated drastically different than if you just went to a hospital. And so why does somebody have to give up their cell phone? Why do we lock people in a little teeny room and not even let them have a bed sheet? Yes, some people do need that, but most people don't. And so we did pass some patient rights, some really basic stuff. Um, and I think that's been helpful. I've gotten some feedback on that, but I recently had a provider who said, yeah, well, I think it's really a pain in the neck that these people get to keep their cell phone. And it's like, okay, I don't know.
Yeah,
I want to be receptive to that, but I also, don't want to take that away from people who can use that safely. And go ahead, sorry.
No, I think this is great. It's a conversation that needs to continue, being ongoing, especially when we talk about having to apply those same allowances in an ER setting where we're held to a standard that is a bit different than an inpatient behavioral health unit, right? We can be fined by the state, and we're not set up to provide inpatient behavioral health, and yet we're allowing people to have access to things that could harm them without as thorough of an evaluation as they would in an inpatient behavioral health unit. So all of these things, one decision goes into play. Where does it impact everybody, and how does it impact the larger group, and what are we actually doing for our patients? I think is just an important conversation for us to continue having. So thank you for all of your work.
Thank you. And sorry, I called you Angela and I meant to say Renee. So I'm going to go just a tiny bit out of order because I saw her hand up and now it's not up. And this is my sister. So I'm going to call on her. Mimi.
Hello, yes.
Oh,
Actually, I took my hand down because it seemed like the two things I was interested in asking about, the NCAR situation and the impact of Trump's mood on people's budgets. So, but I think you've asked that there really isn't a good way to manage the budget when it gets changed, because I feel like I recently read that he was withholding funds here for
yes,
other things. Yeah.
yes, for all the safety net programs.
So is that just becomes a lawsuit?
It becomes a lawsuit. I know that's kind of cold comfort for everybody, but it has been effective. It has been working. And so, and it is kind of hard to know what the other levers are, except for that hopefully we will have an election in 2026. And when I say that, I'm not kidding. Like it literally possible that it could not happen, but hopefully we have an election in 2026. Hopefully, we at least get the House back into Democrat hands so we provide some balance. And I do think it's possible that we could, I don't know that there's a lot of hope that we'll flip the Senate, but I think someday maybe the Republicans in Washington will have some kind of epiphany that what's happening isn't good for their constituents and will come to the table and really help us stand up to Trump. So
One other question. Does any other state have a Tabor like, no, so there's no other role model or no? Okay.
nobody else, and they tried it in other states, and one other state I think passed it and then reversed it almost immediately, and no one else has taken it up because it's terrible.
Well, so why can't our voters vote? There's enough people that like it. Is that why it can't get voted down? Okay.
We've tried, but
Okay.
and we'll try again. I will just say there is going to be hopefully a ballot measure this year for a graduated income tax, and that would lower taxes for the lowest income Coloradans. It would keep them the same for middle income Coloradans, and for people earning more than 500,000 a year, it would raise their taxes. And that also is true for companies. In Colorado, we tax corporations and people at exactly the same rate. And that would be exempt from Tabor. So that money would come in and to the general fund and would not impact the Tabor cap. And it would be potentially $2 or $3 billion. So if you see that on the ballot and you care about that, I really encourage people to vote for it and to help get it passed. All right, next up. Thanks for being here, Mimi.
Thanks. Yeah.
Angela.
Yes, thank you for being here. I am very concerned about an issue of the cell phone towers being erected possibly wherever the telecom companies want. And there's a bill right now on the FCC docket. It's number 25-276 that would basically strip away virtually, all of local power over where these master cell phone towers are placed. And I'm just wondering if there's anything going on at the state level or in our District 18 or in Boulder County that is, working to protest this and stop it. We only have until January 15th to
Okay.
protest to the FCC.
Yeah. So it's a federal bill, and so I don't get to vote on that, but I do get to, and you get to too, to lobby our delegation to have a voice in what they do there. And locally, local governments do have ability to regulate where these towers go, at least for now.
Yeah, yeah.
You do that. So again, I know that everybody, this is the most consistent message I get is please do something. And I want you to know that we are working hard to do the things that we can do that are within the scope of what we at the state level can do. And I know that the local governments are also doing everything that they can do. And a lot of what's happening is happening at the federal level where
Yeah.
just don't have the same ability to pass bills. We have passed a lot of immigration bills and a big one last year to protect immigrants in Colorado, but we don't have the ability. The governor of Colorado cannot say that ICE can't come into our state. And
Well, thank you. What I'm wondering is, what did you mean by our delegation?
our federal delegation, so Joe Neguse, John Hickenlooper, and Michael
Oh,
Bennett. Yep.
Okay, so our Congress people.
Yeah.
Okay. And yeah, and the reason, I'm concerned about it is basically if the FCC allows this, it will allow the telecom companies to basically irradiate us because these towers are going to have an incredible amount of radiation coming from them. And I know people who are being adversely affected by that and sickened. And I've even found out myself that when I go into a building that has no Wi-Fi routers, no cell phone towers anywhere near it, maybe just has basic electricity. I am so relaxed. There's these energies from the earth called the Schumann frequencies that come up and they're very healthy frequencies. But the cell towers are just the cell phone use is just wrecking them. But anyway, I have written letters and I've signed on to letters and I'll be doing another one tomorrow.
Okay. All right. Well, thank you for your work on that, Angela.
Yeah.
Next up, we have, and again, I don't know the pronunciation, Sipita Miller.
Oh, that was really good. Hi.
Okay. Woohoo.
Yeah, so I'm so glad that you are going to hopefully get the thing about AI and therapy done. I work in tech, and a lot of us have gotten laid off in this environment with all the, we're going to do it with AI, but it's just putting more workload on the existing engineers, and the AI is not that great. So there are a bunch of issues coming out of it, and with the way the big tech companies have been um, appealing to the Trump administration right now, there's a lot of skepticism of tech from within tech.
Yeah.
And
Okay. That's good to know.
so I want I want you to know that I'm on the district accountability committee in BVSD, and one of these poor ladies, she has these tech people in her school trying to get them to just remove all computers out of school, like radical anti-tech, and it's coming from the tech workers who
Yeah.
are trying to do this, but we need to balance maintaining our tech literacy and not letting it harm our mental health, our education, and things like that.
Okay. Well, I totally agree with you, and it is actually good to hear that from your perspective because, um, we have a lot of tech companies in this district, and we have a lot of tech workers, and we want to make sure that we're have a balanced approach, but we don't want bad things to happen, and we don't want bad AI.
Yes.
Yeah.
So I'd like to see you support the smaller local businesses over those big tech companies.
Yeah. Yep.
Thank you.
You're welcome. Thanks for being here. Okay, John. You're muted, John.
There we go. I was just going to say that I've been a teacher and I do teach technology. I do computer science and math now at the high school level for the last 32 years. And there is real panic going on in education right now, looking at the kind of shortfalls that we have really, getting education. And I love that you said that, everybody's saying, no, there's no stomach for cutting education. But in the past, we've always been reasonable and said, okay, well, we'll take our part of it. But it seems like that happens every single time. And then, we pass Amendment 23 and then the BS factor comes in so that, education doesn't get fully funded. And so there's a lot of skepticism there. So I was just wondering, what you could do for us in that respect.
Well, we're working on it, but let me just say that to put this in perspective, Medicaid is going to get a huge cut, and the target for those cuts is long-term services and supports. That means the kids who are profoundly disabled, who literally cannot breathe on their own, who have feeding tubes, who are in wheelchairs, who have complex medical needs, those families are going to get cuts. And so how deep do we want to cut that versus asking other areas of our budget to also accept some cuts? So K through 12 there is nothing in the governor's budget, but higher ed, there is massive cuts to higher ed. And, that's also really important. And so it is striking this balance. And depending on what happens at the federal level, if we need to backfill all of the safety net programs that we're currently getting funded through the federal government, I just don't really, I don't know how we're going to do that in a way that's fair and that makes sure that the people who are absolutely have the highest need are getting what they need. And yeah, I think there are some reasonable places where we can make cuts in Medicaid, but I don't think we can take all of what the governor has proposed and put that all on the backs of these families who are, already struggling just to keep their kids alive.
No, and I agree with you in that respect. When the damage that's done to these kids also follows it through to education because we have to pick up where that left off. But the money that's being cut from education at the federal level is a tiny bit of what we get. The money that's being cut intentionally at the federal level for Medicaid and Medicare, it seems almost unethical to take money from the state and backfill federal money that they cut intentionally, that they deliberately are trying to damage people with. You know, I have tremendous frustration with what's going on federally. And I think that we literally have a fascist government. And until there's some kind of reckoning around that, you know, maybe what we do is we fund the people that need it the very most desperately. But, you know, we have to do something to change that.
Yeah, I agree. I agree. So we will continue to work on that.
Okay.
Yep, thank you. Okay, Barbara. Oh,
Hi, can you hear me?
yep.
So I am a, sort of semi-retired physician, and semi-retired in the fact that I have volunteered with People's Clinic in Boulder. It's been a couple of years because I've also done some temporary assignments in Colorado Springs and Estes Park, but my career has mostly been in safety net programs. So, well, one, I wanted to thank you for all your work in mental health, and you partially answered my question with like what's going to happen, what are the particulars of what's going to happen to Medicaid. But I also just wonder, if there's been any effort to survey the safety net providers and see if they're surviving, because even 2 years ago, People's Clinic was not particularly doing well, and with all the people now becoming more uninsured, what the heck is going to happen? And do we even know like what the status is of these places?
Yeah, well, so let me say that they do reach out, and we have met with the safety net providers. Last year there was a real crisis, and we put more funding into that. But as money leaves Medicaid, and let me just say, this is the tip of the iceberg. This work requirements is the least bad thing they're doing. The worst bad thing they're doing is they're cutting, and this is not in 26, it's in 27. They are reducing these provider fees. And this is billions of dollars that will be leaving our healthcare system that we are now relying on. So just an example is the expansion population for Medicaid gets reimbursed by the federal government at 90%. That last 10% is paid for with this hospital provider fee. And we have a certain percentage that we get, and that gets reimbursed through the federal government. So the hospital pays this fee, and then it gets back more than it paid writ large. Some hospitals get a little bit less, but most get more. And they're taking that money away. I mean, that's the simplest way I can say it. They, over the course of 27, over the next 3 years, they will be dramatically reducing that hospital provider fee. And it is billions of dollars. So that isn't just going to affect Medicaid patients, because this is money in our healthcare system. We will still have the same number of people needing the same amount of care, and they won't be able to get it through Medicaid anymore, because Medicaid won't be paying for that. The hospitals won't be receiving these dollars to support these patients and all their other patients. And we will see hospitals closing, not just in rural Colorado, but all around the state. It is literally catastrophic if all of this goes through according to plan. Now, my hope is that we flip the House, we undo some of the worst parts of this program. But we have to start to plan around this massive reduction in Medicaid dollars in our state, which are going to impact all the premiums for everybody else's health insurance are going to go up dramatically. The price that business pays is going to go up. The premiums that employees contribute, those are all going to go up. Everything is going to go up. I don't mean to sound so doom and gloom, but we have literally just begun at the beginning of the things that are incredibly harmful. Warren, maybe you could ask a happy question.
Hello, Senator Amabile. Thank you so much for taking the time to speak with us all today. And also thank you for the very thoughtful and measured approach that you take to measuring the pros and cons of what are very complex issues and looking at the people who bear the burden and who bear the greatest portion and lesser portions of the burden and trying to weigh those pros and cons. So thank you for all that. I am a Medicaid long-term services and supports provider, and acknowledge the challenges that the state faces at a budgetary level and the way that HR 1 has exacerbated those challenges. And I know that that there's no way that anybody is going to get everything they want this year. It's going to be a tough year. I was at the JBC hearing this past Monday when the HCPF, the Medicaid department, was answering JBC questions, and many good questions were asked. I think HCPF has done a very good job of trying to come up with solutions. I think some of their proposals are better than others, and some of those that address outlier spending, that where spending has ramped up extraordinarily over the past several years. Clearly, those are areas that are ripe for some adjustments. But some of the other areas that focus on, for example, reducing the availability of service hours that are provided by family caregivers in home HCBS. Some of that doesn't make a lot of sense because those hours are not changing in terms of the Medicaid members' authorizations. Their prior authorizations are staying the same. So the expectation is that the amount of care has to be met one way or another, but the family caregivers, who are an integral component of our direct care system, are being limited in their ability to provide that care. And there's no way to backfill those lost hours of care, especially with some of the challenges that our immigration system is experiencing at a federal level. So I thank you for your consideration of those kind of issues and for pushing back on HCPF and asking them to do their homework and to go back and say, how can we avoid a situation where by cutting family caregiver hours, we end up providing less hours than the authorized and medically necessary hours that Medicaid members require. And again, these are low income, as you know, these are low income elderly and individuals with physical, intellectual, and developmental disabilities. They're some of our most vulnerable citizens, and we're potentially putting them in a situation that doesn't even save the state money. It just cuts hours.
Yeah. Yeah, I think if you were there, you heard me expressing some concern about all of that and about putting such a high burden on this one group and saying we're going to balance the budget on the backs of these, small amount of families that are in, very difficult situations. And so I think we will do some of what HCPF has proposed, but we probably won't do all of it. And we have to figure out how are we where are we gonna get this other money from? There's so many things in the budget that my colleagues don't want to do. And I mean, I want to finish answering your question, but we're going to be taking a hard look at that. If all the cuts end up doing is forcing more people into institutional settings, we'll actually raise costs, not lower them.
Right.
And so that's a concern too. And also that nobody wants that. So, so we have a balancing act there. And one of the things that's super frustrating about it is that the JBC, we're not qualified to decide, is 56 hours the right amount, or should it be 65 hours? Like, we're not practitioners. We are getting input from practitioners, but at the end of the day, it is 6 people from this pretty broad backgrounds who are going to somewhat arbitrarily decide. I mean, I don't want to say we're doing things in an arbitrary way, but you know what I'm saying? Like, we're just going to have to pick some numbers because we have to balance the budget. So
I think you're asking good questions and keeping HCPF honest to responding to those questions in a way that does the least harm to people. That's where I think we need to keep our focus. So thank you for that.
Okay, thanks. So I see Isaac has his hand up again. And Isaac, do you have one more question?
Yeah, sorry. Sorry. I know that's like the end of the meeting. I just wanted to, because I totally crossed my mind. I had talked to Jonah Goose a couple, maybe couple months ago. What I had asked him is about the Hudson ICE Detention Center that's being built. I know that they had a plan. They were suing was it ICE themselves, just because of the Sorry, well, I just totally lost my words. But so I knew they were like gonna sue somebody about it. Is there any progress on that or any update?
Yeah, I don't have an update on that, but it is
Okay.
all ongoing. And, I don't think people in Colorado want us to set up a ICE detention facility here. And I don't think we want ICE to be here at all. I know I do not want ICE to be here at all. And, unfortunately, it's happening. And I don't know what happens when we end up in a situation like Minneapolis. But we will have to take to the streets.
Exactly.
Yeah. Okay, thanks. So we're at time and I don't see anybody else's hand up. So I want to wrap up and honor your time. First of all, I want to say thank you to Robin, who is my ledge aide and does all the work that happens here that makes these meetings happen and all the legislative stuff that we do. And Robin is integral to everything that happens in Senate District 18. So thank you. And thank you to all of you for being here. And, I do need, I'm so glad that Lauren showed up at the meeting, the JBC meeting. The JBC meetings are weird. They're boring, they're long, and the public doesn't get to speak. But people come and we know they're there and it has an impact. And you can also listen into what we're doing, online. And there is actually, oddly, a huge amount of people who are listening because I get texts from all over in the middle of those meetings saying, you should ask this, or you didn't ask that, or that was a good point, or they're lying, or whatever it is they think, they text me. And it's okay. I don't mind. It helps all of us if all of you are involved, and you wouldn't be here tonight if you weren't. And I think it is going to make a difference. And so I really appreciate that. We are looking at some really tough choices, and we are in a very tough and weird world. And I just need you to not give up. Don't look away.
Thank you.
Thank you. Thanks for being here, Phoebe. And I just want to say, Phoebe gave me a vest that's heated, and I've worn it every single time I've gone hiking. So thank you all for being here. Have a good, safe night.